My older brother Charles first had a seizure when I was 6 and he was 8 years old. Charles was first diagnosed with a rare genetic disorder, Phelan-McDermid syndrome, then diagnosed with epilepsy, and then further diagnosed with Lennox-Gastaut syndrome, a severe form of treatment-resistant epilepsy.
Lennox-Gastaut syndrome is an epilepsy syndrome that begins early in childhood, and the patients have multiple seizure types. The reason it's refractory is that most medications we use don't completely make the seizures go away, nor do they at all address the cognitive and behavioral problems that the patients have. They often have to go on to have epilepsy surgeries or other modalities of therapies, and those often don't work either.
Charles has had dozens, if not hundreds, of seizure treatments. He's currently on 6 seizure medications at once, and that's not including his emergency seizure medications that we often have to use. He's tried nearly every viable option for treatment, including clinical trials, and most of the combinations would work for a period of time, but the seizures would always end up coming back.
Long-term patients with medically refractory epilepsy usually do not find seizure freedom. And because of that, if it starts in childhood, they will often have difficulties with their cognition and behavior and making friends and socialization. The family that takes care of a child or a family member with treatment-resistant epilepsy has their whole world changed. They need to always be cognizant of how that child is going to be taken care of if they have a seizure when they're out. And that really changes the entire dynamics of the family. And there's always this worry that they have to keep thinking about that child or that family member and what to do for them and keep them safe.
Growing up alongside Charles was both confusing and scary for me. It took a long time for me to understand that he couldn't communicate through traditional ways. But I learned a lot of responsibility at a young age. Oftentimes my parents would be in the hospital for weeks with Charles, and I would have to stay with family or friends. Our whole family was scared, and we had a lot of questions with not enough answers.
We are making advances with devices. New gene therapies are coming to fruition, and there are some medications that are very focused on patients with refractory epilepsy. So personalized medicine, I think, is going to improve the field and make a lot more patients seizure-free.
Charles has taught our whole family patience, compassion, and perseverance. Charles is absolutely motivated and inspired me to pursue medicine and research. In the future, I hope to pursue translational neuroscience, translating findings in the lab to tangible outcomes for patients in the clinic. Our first introduction to CURE was actually through Charles's epileptologist, Dr. Ann Anderson.
CURE has really been the nidus for innovative young scientists to get their careers going and keep them in epilepsy.
Our family's seen firsthand how CURE is funding revolutionary science in the epilepsy field.